Very good afternoon. So, last PG class we had, was 2 days back, and the remedy we discussed was the Antim series. Okay, we spoke of antimonium crude, and then of course Antim tart, and last class I spoke was antimonium arts. Okay, so I hope you have got a small clarity, when Antims. And I did share few cases from the clinic. Antim tart, especially we think of in respiratory affections, and also antimonium arts is thought of in respiratory. Antim crude comparatively is a more deeper acting remedy. Okay, and it has an affinity for GA skin. Skin reminds me of a small case. I don't know who was there yesterday in clinic. We had a case, one more friend of yours was there in the clinic. We had a case of warts, okay, hard warts on the dorsum of the leg, okay. So hard warts, one remedy that comes to our mind is antimonium crude. And from the clinic, from the practice, what I have seen is hard warts are more easier to treat. I don't know, I might be wrong, it's my experience. I've been a big failure in soft warts. We have many extra growth skin tags coming, and I've stopped taking cases of skin tags because I've not been very successful. But hard warts, I have had beautiful results. Dalcamara, antimonium crude, sepia, a few remedies you can think of. Okay. So today I had a different plan for you. Assuming Antim group is clear, we'll start with a very simple remedy. And when I'm taking back to your anatomy classes, when you start looking at this image, there is a finger pointed over a particular area. And it's too silly to ask a PG student what that area is. Okay, so what is that area that I'm going to focus there? Supraorbital, very good. I know it's a very easy thing. And the next simple question again for a material medical PG student is, what remedies you can think of, or what remedies come to your mind when we talk of supraorbital region? Pain in supraorbital region, what are all the list of remedies you can think of? Sanguinaria, okay, good. And when somebody is talking of sanguinaria, the other remedy that comes up is Vijaykrishna. See, but sanguinaria, you need to understand, has pain starting in an area and radiating back. I am talking to you about a specific area here. Supraorbital region. Only region, there is no extension, there is no radiation. That's why even in your repertory, I was shocked. Sanguinaria is not mentioned. Spigelia is not mentioned. Because sanguinaria and spigelia, they have hemicranial headaches. Pain starts and then it ascends up. Okay, so that kind of a thing you don't have here. It's this supraorbital region. Kali groups, okay, good. Kali also makes sense here because the pains are pointed, and Kalis have that spot-like pains. Pains in spots. Not spot-like pains, sorry. Pain in spots. Okay? Kali bike. So you have Kali carb and Kali bike for supraorbital pains. And any other remedies you can think of. Simple remedies. Right-sided. Left-sided. Okay, you also have children. You also have lachesis. Okay? And cinnaberis. Cinnaberis, causticum. Some 20 to 25 remedies are mentioned in your book. Okay? Tuja, Naxwamika, Netrimur, Naja, Veserium. Calibai, Calicar, Ferrum, Conium, Cinnaberis, Cheridonium and causticum. Okay? See, today we will try to focus on a very simple remedy, an element, fine. And this is what I wanted to highlight. This is what we are trying to focus on next few minutes. And the remedy that we are going to discuss is selenium. Okay. Now, as a PG student, you will be having, or you would have come with an information, which you already know about selenium. So just we'll have a 2 or 3 minute discussion, what exactly you are aware about selenium, so that we also get a clarity what else we need to add. Okay? Now what is it that you are aware from your UG knowledge, from your OP knowledge, from your IT knowledge, from your clinical knowledge, what other details you have about selenium? What is it? Very good, beautiful. She starts with a very vital point in selenium, and that vital point is a beautiful remedy for impotency. Good. We'll explore that area, we'll try to understand when is selenium for impotency. Good. Yes?
Ailments from exhausting diseases.
Okay, ailments after exhaustive diseases. Good. It is there.
Constipation.
Okay, there's something very peculiar about constipation. They've just given their exams. It makes sense, when we're getting answers from that corner. Okay, good, very good. Selenium has constipation. Can somebody quickly tell me what is special in selenium constipation?
Anxiety that it would tear the anus.
Okay, anxiety will tear the anus, and like Silesia, stools have to be removed mechanically. Okay, hard, obstinate constipation. Again, we'll look into that area a little later. Good. Constipation, impotency, and ailments from exhaustive diseases. Good. Anything else? Selenium.
Early senility.
Very good. Dr. Venkat has a point. Early senility. See, as a PG scholar, early senility is also taking us towards a direction. And what is the direction we are talking about? It is giving us an indication of the miasm. So the predominant miasm that you see in selenium will be syphilitic. You will slowly understand. As we unfold selenium, you will slowly understand. Okay, good. What is it? Premature senility. Good. It's a valid point. Any other information? Okay. It's got an area, it's got a sphere of action where it affects the larynx. Okay, vocal cord, larynx, good, agreed. We'll slowly understand with cases what exactly selenium does on the larynx. Good. Okay, anything else? Any other area or any other information? First-hand information you have about selenium, so that we can explore the remedy in detail.
Similar to sulfur.
Okay, similar to sulfur, okay, good. Now, what is that area that it is similar to sulfur is also very important. Okay, similar to sulfur, okay. See now, if you look at selenium, it's an element. I'm not going into the chemistry part, I'm not going into the periodic table, but what you need to understand is, it is found, as Netra rightly said, it is found in association with sulfur and tellurium. And where exactly you see this in our body? Okay? Selenium is mainly seen as a constituent of our body. Mainly it is seen in bones and teeth. So these are two areas where you see selenium in our body. Okay? So the first area that we spoke here was, it is a remedy which affects the supraorbital nerve. Okay? And it causes neuralgia. Okay, that's the first sphere of action. And second, very important, what one of our friend was talking, it's a beautiful remedy for impotency. Okay? From Google Images, you realize that it's a remedy for impotency. Okay. Now, what is the speciality or what is the character of impotency you have in selenium? First question. And as a PG scholar, what are all the other remedies you have in your mind when we talk of impotency? Yeah, it's a question. Very good, Agnes. Lyco, caladium. Good. No, they're all there. Good. Huh?
Fluoric acid.
Fluoric acid. Argentum. Yes. Phosphorus. Good, no, it's all there. But see, knowing the remedy is one part. Now what is the toughest part? when do we indicate that remedy? Meaning clinically, when phosphorus, it's a very nice remedy. And I've got something very interesting to share about phosphorus. Okay? See, phosphorus, any quick inputs, what is the impotency or what is the character of impotency you have in phosphorus? See, for example, don't take me wrong, but I'm just giving you a situation. For example, if a man having or getting physical for the first time and is pretty excited, okay? Many movies you would have seen this particular scenario, and you would come unsatisfied or dissatisfied. Okay? So the impotence in phosphorus comes out of excitement. Excitement brings impotency. So please remember this and try to apply practically in future. When somebody is excited and in the process he lands up being, he is not able to have erections. Okay? Fine? Off the camera I'll explain in detail, but this is what you need to understand for time being. Phosphorus. Okay? The second very important remedy somebody was talking, Dr. Padmashri was talking, was lycopodium. I've given you one beautiful situation of lycopodium. Now what is that situation of lycopodium? Yes, Professor Vijaykrishna, if I am right, writes in his Materia Medica. And it is also there in the repertory. If you read the male chapter in the synthesis repertory, there is a very interesting rubric, impotency with wife. So what is the statement that you need to understand? Impotency with wife. Meaning what?
Fear of responsibility.
Okay, see, more than fear of responsibility. Okay, impotency with wife.
It's more egoistic. So
Okay, more see, it's a very simple statement. Let's not complicate it. Ego, responsibility is a very simple statement. Meaning,
Otherwise,
yeah, with other women. Fine, with other women, they have very good erections. But own wife, they have issues with erections. Now, why they have issues with erections could be, I don't know. It could be because of responsibility, or it could be issues, ego issues. Fine, must be they had a fight, I really don't know. Could be. We'll explore those things a little later. But now what I want you to understand is, but how many patients will come with this kind of thing? Sir, outside I'm fine, at home, I know, this is the issue. At least in an Indian setup, it might be a little difficult. Okay. Now this also takes us to another area of lycopodium, that lycopodium patients are adulterous. Okay. Lycopodium patients are adulterous. So it can be justification in lycomate giving. Okay. Fine. It can be justification a lycomate might be giving. But remember, if you're lucky you get a situation like this tomorrow in your practice, impotency with wife. Okay. Indian men might put it in a very subtle way. You should be smart enough to grasp it. Okay, our society is not, we are still few areas, as a doctor, as a patient, few areas we are not comfortable. We are not comfortable as doctors asking, and they are not comfortable as patients in sharing things openly. But it's a very nice statement given in Materia Medica. And somebody, if you ask me how do we use it in practice, yes, it can be used, but you should know how to elicit the symptom. So lycopodium, again lycopodium has one more very important thing. Other than impotency with wife, there is another very important angle of lycopodium. Lycopodium will have excess desire. Okay, fine. So emotionally or mentally, you see lycopodium having excess desire when it comes to sex, but is not able to perform the way how you want or how we imagine it to be. Okay, so that's where even selenium comes very close. And lycopodium, especially in old men, Impotency in old men who have excess interest, lycopodium. And that's where even selenium comes into picture. Somebody was talking about caladium. Any quick inputs when caladium? When caladium? See, in caladium what will happen if you read good materia medicas? What they say is the part is relaxed. The part is cold and the part is relaxed. See, there is only one remedy in your materia medica. In spite of caressing, okay? In spite of foreplay, caressing and all those things, there is no erection. Single remedy, caladium. Okay? Okay, done. Good. So any other remedies you can think of? Lycopodium, caladium, phosphorus, onasmodium. Okay, sorry, I don't know much about onasmodium. Any inputs from your end? Psychological impotency. Okay, could be, it's a new learning for me. Good, and thank you. Onasmodium. One of the PG friends says psychological impotency, meaning it's more to do with mind. Okay, good. We'll explore this remedy. Okay, onasmodium, good. Any other remedies? Agnes castus. Now, what is the situation in Agnes? I was sharing in one of the classes. Now, in Agnes, if you want, I can share a case. In Agnes, I was fortunate to treat only one patient related to this fear in Agnes. Now, in Agnes, we had a patient, who had come for infertility, primary infertility. Young wife, and he is little, he should be 36, 37. Wife is on 19, 20, and they have been trying, and unfortunately, she is not conceiving. Now, the problem is with this gentleman, he has hardly any erections, and he was telling me that, sir, before marriage, few years back, I was in full vigor, and every day I used to get physical with different women. Every day, I used to change partners, that kind of a guy. And today, his own wife is not able to satisfy him. Hardly any erections. Now, this is where I had given Agnes way back. And this is what Netra was trying to tell Agnes. So please remember, Agnes is after overdoing. Okay, impotency which comes after excess, excess usage. So this is one case I can share with you where I had used Agnes. Okay. So Agnes and any other remedies. See, there's also graphites. Graphites. Now, the situation in graphites is aversion to coition with impotency. Okay, please remember. I have used it in a case, must be after a few weeks, I share the results. Impotency with aversion to coition. Okay? Done? And you also have remedies like Barretta carb. You can also think of remedies like Sinapis nigra. Sinapis nigra, one symptom that always comes to our mind when we talk of Sinapis is alternating. Nose block which keeps alternating. That's what I remember reading in my UG classes. Okay? So Sinapis, or I don't know if I got the remedy right, it's a rare remedy. So there, out of fear of coition, they will have impotence. So when Venkat was talking of onasmodium, which he says is a psychological impotency, I had Sinapis in my mind. So Sinapis will have fear of coition, so they will have issues with erection. Sinapis, okay? So graphites is what I was trying to tell you. See, calibrome, I wanted to tell you about calibrome. So calibrome is again something like onasmodium. Calibrome will have a lot of sadness with impotency. Loss of memory with impotency, single remedy is calibrome. Sadness with impotency, calibrome. You have many more remedies. Lycopodium in old people with excess desire. This is what I wanted to bring it to your notice. Caladium we just saw. In caladium, it is absolutely in a relaxed state. In spite of kerosene, there is no erection. That is caladium. And caladium, one more point, quickly, if somebody would like to, share. After abuse of tobacco, impotency after abuse of tobacco is caladium. Okay. So synaptis is what I was trying to tell you, and then we also have in diabetes. So it's a very practical situation. Many times we have diabetics coming to our clinic with a very sensitive problem, and they say, sir, since I have been diagnosed with diabetes, my libido has come down. Please give something to improve my libido. Fine? Okay. Hardly any erections. Is what patient seeks help. Okay? So 2 remedies you should remember here. Very good, beautiful. Helonius and Mascus. Helonius and Mascus. Only 2 remedies, and both the remedies Netra has got it right. Helonius and Mascus. Okay? Now phosphorus is what I was just trying to explain when Vinod was talking of phosphorus. Phosphorus is out of excitement. Impotency which comes out of excitement. Okay, is phosphorus. Right? So these are few remedies, and selenium is also a remedy which acts on the genitalia, weakens the nerves, and it can cause impotency. Okay. We'll look at selenium a little later in detail. So 2 areas I have explained. One is supraorbital nerve, and second thing is genitalia, or the male sexual area. And the third thing is liver. I know we have better remedies in homeopathy for liver affections. Okay? Can I have some inputs, some discussion? The PG class last hour 3 to 4. I know it's going to be tough both for the student and for the teacher. So some interactions that I also feel you are all awake, you are all concentrating and focusing on the class. What remedies for liver? It's a very UG level question. I know, a lot of UG level questions today. I know, you start with Selenium, good, Cardas, Lyco. I want to bring Natrium sulf here to your notice. Natrium sulf, any emotional cause affecting the liver. Okay? Natrium sulf. Okay? Natrium sulf, very good. There's a small talk coming up in the college on 22nd. There I'll be showing you a case of liver disease. Okay? Chronic CLD, chronic liver disease. Fine? Where the bilirubin was 6+. How beautifully it comes down to normal. And the best part is the structural changes in the liver, they also are reverted back. It's a beautiful case. It took a lot of time. We have considered a lot of mental symptoms and of course some particular symptoms, and then we have prescribed. So I'm just igniting a spark. I hope I was successful in creating a curiosity. And after 2 days or next week we have that small talk coming up. So there we will be talking of this particular case of CLD. Okay. Selenium, Cardas, Natrium sulf, Aurum, China, Lycopodium, phosphorus. There are plenty of remedies. Okay. So selenium mainly causes enlargement. Hepatomegaly. We don't have too much of information under sphere of action. Must be when I do the second part, I'll share a little more. Netra, if I'm right, was talking of one area. She was talking of the vocal cord being affected. Okay. So if you read Allen keynotes, I'm talking of a small book. There again Dr. Allen mentions about selenium having an affinity for voice box, larynx. Okay. So being a PG class, again, to keep the class going and interactive, what are the remedies for hoarseness or for aphonia, whatever, on the larynx, what is selenium doing? Selenium mainly causes hoarseness of voice. Okay? The nodules, fine, they can be affected, or the laryngeal muscles, they can go into weakness. So you see a selenium person straining too much, when he is using his voice. Hoarseness mainly from overuse of voice. Okay? Or hoarseness mainly in singers. Two areas where you can think of selenium. Okay. Now before I take up the next topic of selenium, quickly, what are the other remedies for hoarseness of voice? Argentum nitricum, good. Iron triphyllum, yes, iron triphyllum. Causticum, heparin, good, it's all there. Coca, Sericia, okay, good. Cocculus, that's there. Huh? Pig. Okay. You will have to tell me the indications at least. Okay. Yeah, good. I mean, this new remedy, it will be a new learning. Like for example, monasmodium. Okay. Then see antimonium crudo, belladonna, phosphorus, calcarea, carbovage, bromine. Hoarseness of voice, aggravation, dust. Hoarseness of voice getting overheated. Only remedy is bromine. How is it different from antimcrude? Antimcrude, it will be river bathing or cold bathing under hot sun. Netra, I hope you are clear. Getting overheated, hoarseness is bromine. You take cold bath or you play in river water under hot sun, then it is antimcrude. See, it's very important to understand the difference. I have been successful in treating a case with antimcrude. I have shared it in some class. Bromium, I have never had an opportunity, at least with the hoarseness of voice. When belladonna, when phosphorus. There you will have more of painful hoarseness. So you will see more of inflammation there. You getting my point? Calcarea carbovage will have painless hoarseness. Belladonna and phosphorus will have painful hoarseness. Carbovage and calcarea has painless hoarseness. Calcarea have hoarseness more in the morning. Carbovage hoarseness more in the evening. These are a few differentiating factors. Iron triphyllum. Then again, aphonia. Aphonia, exposure to cold. Same, Vinod was talking of heparin. Hoarseness of voice from exposure to cold. Okay? Argentum met has an affinity for ligaments. Argentum met has an affinity for larynx. Okay? Argentum nitricum, single remedy. What is the beauty in argentum nitricum? Hoarseness of voice on high notes. I'll just explain this statement, it's very important because it's a single remedy. And many times we have singers come into our clinics. What is that situation they are going to tell us? Sir, when I go high, sir, that song demands me to go high pitch. When I go high pitch, my voice will become hoarse. Now that is argentum nitricum. Hope you are getting an idea. That is argentum nitricum. Okay? So we mainly focused on this purification. And four small areas we try to understand. One was supraorbital nerve, and second thing what we saw was what is it? Huh? Genitalia, yes, correct. Yes, when you stopped, I was also worried. What is it? Male genitalia, predominantly male. We have very less symptoms related to female. male genitalia, and then we spoke of liver, and of course the larynx. Okay. Netra was talking of nodules. Okay. So I am not sure if selenium is there under vocal cord nodules, but two remedies I want you to remember is Berberis vulgaris and Tuja. Okay. Berberis vulgaris and Tuja for vocal cord polyp or for vocal cord nodules. Though I had shared a case of phosphorus, beautiful case of a teacher whose polyps got dissolved, vocal cord polyps got dissolved constitutionally with phosphorus. So when you are not able to figure out the constitution, which happened with me very recently to a pandit who had a vocal cord nodule, and he was not able to recite the mantras, voice had become hoarse. There I had given him Tuja because I did not get anything else. Please don't prescribe Tuja. Try to understand why his body is compromising on his voice. Okay, try to find out the conflict. I did sit with him, talk to him for some time. Unfortunately, I could not get the conflict. Okay, and from my past experience, I have seen Tuja doing wonders. When you don't get any single remedy, which is fitting into the case. Okay, so just remember Tuja. Never use Berberis, which is also mentioned in your repertory. Never got a chance. Because whenever we think of Berberis vulgaris, unfortunately we are so prejudiced. We only think of stones, kidney stones. We don't think beyond. Okay, must be we need to explore. See who has contributed Berberis for vocal cord nodules, and then we may have to explore that a little more. As a PhD scholar, you need to take it up a little more seriously. Okay. So, I was just trying to ask you about the other remedies which you have told. One remedy you missed. And what is that one single remedy you missed is Stephysagria. So when Stephysagria in hoarseness of voice, at least students attending my clinic, we had one case. I don't know who was there with me that day. A lady had gone into hoarseness of voice. I had seen her 3-4 days back. She was absolutely fine. You understand the situation? 3-4 days back she was absolutely fine. She was talking, all those things. After 4-5 days when I meet her, voice has become hoarse. So what is it? How do you proceed in this case? So what do we ask for? We ask for ailments. What happened? Say, she had a huge stone in her gallbladder. Okay? So 4-5 days back she had come inquiring to me if that can be treated with homeopathy. And the pros, cons, if at all I take up, there are few cases which are gone, few cases which are not gone. And for example, what could be the complication when she has to see the surgeon and all? We had a nice, neat talk. But ultimately the couple decided, no sir, we'll go to surgeon and we'll get it operated. I said, fair, it's up to you, it's your choice. So she went, she underwent the laparoscopic surgery, everything done. And after 4-5 days when she came back, casually, what we saw was her voice had gone hoarse. She was not able to speak. A lady, a tough lady, strong lady, voice has gone hoarse. So what is the question? One question you want to ask in this lady. Where you felt there is no use talking? Where you felt there is no use talking? See, the hospital, when they took her in, they said the insurance will cover everything, expenditure, everything. And once the surgery, everything was done, then it was told, or she was told, the family was told, sorry, it is not covered by your insurance, some technical issues. So you have to pay some 1 lakh plus. So she got angry, and then she couldn't express her anger. surgery, laparoscopic surgery and all those things. That was the situation. See, there's a beautiful rubric in your repertoire. I don't know if any of you have seen the follow-up of this particular lady. I don't have the permission, I am not sharing the video as of now. If she permits, I'll share the video. But what is important for us is, after that remedy, she improved. And again, if you see there, what Netra was telling, she underwent laryngoscopy, and laryngoscopy shows a nodule. Here again, I did not prescribe berberis. Here again, I did not prescribe tuja. Because I, as a classical homeopath, got what I wanted. Okay. So there is a rubric. Hoarseness of voice, anger after. Anger after. And if I am right, humiliation after, something like that. Single remedy is Stephysagria. So after 15 days after Stephysagria, much better. That recording I have, voice is loud and clear. Stephysagria. Mortification on the hoarseness, mortification after, and hoarseness, anger after, single remedy is Stephysagria. Okay? Now, how exactly a selenium patient looks? This is what Venkat was trying to tell us. What was Venkat's statement? Premature senility. Okay? They look old. They look old. Good. They look old. They are not old. They look old. I hope you understand. Fine? So what is important here is, there is emaciation. Emaciation of face, emaciation of hand, emaciation of limbs, done, and they look prematurely old. It suits to light complexion, great emaciation of face, hands, legs and feet, early senility. This is the statement given in our books, Materia Medica. So quickly, what remedies you can compare here? What remedies come to mind? This situation, okay, lycopodium, opium, argentum, argentum nitricum, aubratinum. Don't forget aubratinum. Okay, argentum, lycos, selenium, opium. Child looks like a mummy. Fine? Not mother, mummy. Mummified thing, okay? So, we'll quickly look at the ailments. Any quick questions here? 40 minutes of the class. We have compared many remedies because it's a PG class, and it's important you need to understand the comparison. Because tomorrow in your practice, when you have a series of remedies that comes up after repertorization, okay, you should not be in a doubt. Or even if you are in a doubt, you should know how to differentiate them. Okay. So we'll take up the ailments. That might take another 15 minutes. We'll try to go a little fast and cover. So ailments, Netra was talking of debilitating disease. Any other ailments? Tobacco, sexual excess, alcohol, loss of fluids. Okay, they come as a cycle. So first important ailment what you have is ailments from tea. Okay, quickly what remedies? Tuja, good. Tuja, China, Pulsatilla, very good. Okay, so I'll just try to show you a model of how ailments can be studied. Fine? So as a PG scholar and a potential teachers in future, if you feel it is feasible, this can be applied. So as a comparison for a PG student, I have just tried to give you few more remedies taken from our books, source books. If there is vertigo, if there is hysteria, for example, a lady drinks tea and then she becomes hysterical. Hysterical. Only remedy we have is valeriana. Valeriana is a hysterical remedy. Okay? So valeriana is the remedy, and for example, if there is vertigo, you have two remedies after tea, Netremur sepia. Okay? Netremur and sepia, and then you have headache. Like Padma Shri, whatever she has told, many remedies come in this. China, Glonine, Lacasis, Nux, Sepia, Tuja, Veraton. Balaton. And single remedy you have here is optic nerve anemia, okay, which in turn affects the vision because of T. Single remedy is spigelia, okay, spigelia. Optic nerve anemia, face becomes, okay. See, I mean there was an image. Unfortunately, it's not getting. Face becomes red. See, this is not taking red color. Our LCD, it's not taking red color. Whatever is shown in red, it is all becoming black here. So face becomes red after T. Only remedy is Plantago. Okay. Plantago. I mean, as a student, I was told it's a beautiful remedy for tooth pain. In the initial days of practice, we used to use Plantago for toothache, especially mother tincture. I have used it, mother tincture, for toothache. So toothache after tea is China, coffee, selenium, tuja. You see selenium there. Selenium can also have headaches after tea. Gastric disturbance. Gastric disturbance, like for example, disordered stomach, you have China, diascoria, ferrum, pulse, pteridium, hiccups, single remedy is lacasis. Somebody drinks tea and they have continuous hiccups, the remedy is lacasis. Similarly, sir, I don't drink tea because if I drink tea, I have gastric distension, abdomen distension, single remedy is China. Okay? And constipation, Kali hypophosphoricum. Never use this, but it's there in books, you can check. Cough after tea, ferrum, spongia, Kali. Sleeplessness after tea is China, Maxvomica, Naja and Pulsatilla. So these are all the remedies which have tea as an ailment and what they can cause. For UG it may not be very useful, at least for a PG scholar, we need to upgrade with our teaching. See, teaching selenium for UG and teaching selenium for PG, there should be some difference. At least when you go back home, you should go back with the feeling that I learned something new as a PG scholar. Okay? So tea as an ailment, and then many of you are talking of sex, many of you are talking of alcohol, and you are also talking of loss of vital fluids. So one word you need to remember here is debauchery. Excess indulgence in wine, women. Okay? So if you just see here, wine and women. Yeah, remedies first. Other remedies. Agnes, okay. Fluoric acid, agreed.
Ranunculus.
Okay, I am not sure, could be ranunculus, no issues. Kindly check ranunculus. I have never used, so no idea. Okay, Naxvomica, see, simple remedy is Naxvomica, top remedy. And never forget picric acid, especially for women. Picric acid. Opium, soranum, caladium, carbovate, China, fluoric acid, lacasis, agaricus, few remedies. Okay? Here again I will just try to give you soranum when there is dullness, mental dullness after waking, after debauchery. Single remedy is soranum. Okay? Headache, Naxvomica, agaricus. Deranged stomach, carbovate, China, Naxvomica, Kali. And diarrhea, you have antimonium crudum, yes, antimonium crudum and Naxvomica, diarrhea. Okay? See, in present situation, they can come with, a lot of alcoholism or men being womanizers and all those situations, and there are all these things you can think of, these remedies. Okay, yeah. Cough, it is Naxvomica and stramonium. Okay, ailments from sugar. You have better remedies. Argentum, sulfur. gastric complaints after sugar, sulfur.
itis.
GI complaints after sugar, argentum. Okay? The many remedies, I am cutting it short. See, I have just given you a pattern, meaning I have just shown you a pattern. So as a PG scholar, you can take this as an assignment, you can go back and see which are all the remedies which have sugar as an ailment and what can those remedies cause. What will be the target organ in those remedies. You can take it as an assignment, okay? Because this itself took a lot of time, preparation. So sugar and surprisingly salt. One remedy you should remember, bad effects of salt. Don't tell me natron. Very good. None of it will natron. Good. Phosphorus. Bad effects of salt. And bad effects of exertion, mental exertion, physical exertion. Bad effects of overstudies. Again, better remedy, picric acid. Better remedy, coccolus. Okay. Overstudying, salt, sweets, mental and physical exertion. Ailments from lemonade. But say belladonna, they have desire for lemonade. So here it is ailments. Say belladonna, acid fast are the remedies which have desires. Belladonna, they have desires for lemonade because they need more energy. Okay? So here lemonade is an ailment. So in selenium, we take after lemonade. Single remedy is selenium. What is it? Headache after lemonade. Single remedy is selenium. And second, nausea. Pulsatilla, cyclamen. Then you also have, rectal complaints, diarrhea, antimproved and phytolacca. Okay? So lemonade, and then we're mixing up things here. Ailments from masturbation and ailments from sexual excess. This in turn leading to loss of vital fluids. Okay? See, vital fluids, what do you understand by vital fluids? Loss of vital fluids. Like for example, not necessarily it should always after intercourse. Like for example, diarrhea. For example, vomiting, sweating, okay, blood, excess menstrual flow. This can be taken as vital fluids. Vital is something that is important. Done? So what you have to understand here is, in selenium, you have masturbation, sexual excess and loss of vital fluids. Bad effects of masturbation. Some remedies. Bellies. What will happen in bellies? If I am right, bellies will have pain in back. After sexual excess, bellies will have pain in back. Okay, you please cross check. But from what I remember, bellies has backache after sexual excess. No, it's right, correct, good. Bellies has backache, correct. Okay, I never expected bellies. Good, Netra, bellies, then. Acid fast. Bufo. Yes, bufo. What is the specialty in bufo? Wants solitude to masturbate. Okay? Wants solitude to masturbate. I know many of you are staring at me, masturbation is a private thing. Fine? But whenever they are alone, no, bufo gets that thought. You're getting my point. Whenever they are alone, first thought what bufo gets is, let me masturbate. Okay? And mentally also not that, intellectually not a very intelligent guy, like Barretta. The only sphere that is what developed is sexual sphere, before. Okay? Sexually, they will have good knowledge. Early masturbation and early watching pornography, all those things will be before. Same intelligence, you will not be using it for studies. Before. And acid fast. Acid fast will have good erection. When you talk of impotency, when they are having, during the act, they lose erection. acid flows. I've used it in 2-3 patients with beautiful results. During the act, they lose erection, acid flows. Okay? So, pain in eyes after masturbation, which is the remedy? Pain in eyes after masturbation. No, it's a surprise remedy, and the remedy is a child remedy, and the remedy is Sina. Sina. Okay? Acne after masturbation. Many times we have young boys come into clinics telling sir, when we ask them when is it more, they give you a pause, they feel shy, they don't look into eyes, and when we take them into confidence and when we start questioning them in detail, they say, sir, when I masturbate, I have acne. Single remedy, and the single remedy is phosphoric acid. Okay, and indigestion, very tricky remedy, like Sina. Think out of the box. Don't think of lycopodium, don't think of China. Indigestion from masturbation. Single remedy is Barretta cup. Okay? Involuntary urination after masturbation. Again, a very interesting remedy. Sepia. Okay? Yeah. So what we did in today's class, 45 to 50 minutes, we just started a very interesting remedy, Selenium. And if you know, we have not covered much, or if you look back, we have covered too many things. Fine, it all depends how much you are able to grasp. But two things we have covered is spherefaction and ailments. And spherefaction only 4, and ailments might be some 8 to 9. That's all what we did in today's class. So in the next class, we'll continue with Selenium. We'll be talking of characteristic symptoms with comparison, and if time permits, we'll also take up mind. And in the last class, we can wind up or we can end with the particulars. I'll be focusing on head. There are few symptoms related to the respiratory. We'll be talking of male genitalia, and clinically where it can be indicated, we'll be trying to take it up. Okay? Any quick questions before I close? So recap, we spoke of spherefaction, physical appearance and ailments. Done? Okay, Shalaka, right? Yeah. Chala, thanks.